webinar. Sorry. I would like to welcome you to our final Health and Wellbeing webinar, focusing on supporting unpaid carers from ethnic minority communities, which we are delivering in partnership with the West Yorkshire Health and Care Partnership. Over 600 people stop working every day in the UK to provide care for a family member, neighbour, friend, or loved one. Excuse me. 1 in 7 people are working carers, and around 400,000 unpaid carers live in West Yorkshire, many not identifying themselves as such, and all have an invaluable role supporting those needing care 365 days a year. Nationally, unpaid carers save the economy £132 billion per year. The West Yorkshire Healthcare Partnership's Unpaid Carers Programme is committed to supporting and recognising unpaid working carers living or working within its 5 local places, including Bradford and Craven District, Leeds, Kirklees, Calderdale and Wakefield. Evidence shows that many unpaid working carers across the West Yorkshire Healthcare Partnership workforce face a multitude of challenges because of both caring and being from an ethnic minority background. All organisations that form the West Yorkshire Healthcare Partnership want their health and care system to be a supportive environment where they fully understand the needs of its diverse workforce. Today's webinar, Working Carers in the NHS and Healthcare Setting, will open up a discussion around the challenges and inequalities, as well as understanding how managers can best support their staff through the Working Carers Passport. Today, we will be hearing from our amazing panel, Shaheen Khosa, who is the Race Equality Manager for the Unpaid Carers Programme at West Yorkshire Healthcare Partnership, who will be providing an overview of the carers agenda. We will also hear from Kez Hayat, Elaine Powell, and Anita Emma, who have kindly offered to share their personal lived experiences on how they balance their busy working life whilst providing unpaid care for a loved one. Please note that this session is recorded and will be shared on the West Yorkshire Healthcare Partnership's website and the Race Equality Network's YouTube channel. We encourage everybody to keep their cameras on because we would like a meaningful and interactive discussion. But if you wish to keep them off, then that's entirely up to you. Fatima from Race Equality Network will share a poll before our panel are introduced with 4 questions, which I would encourage everyone to kindly complete. The poll will be used for evaluating the outcomes of these online webinars. There will be opportunities throughout the session for you to ask our panel questions directly and via the chat box. So Fatima, would you like to share the poll? And then we can get everybody to complete them. They're just a quick tick box exercise with 4 questions. So if you could complete that, and then we'll put that up again later on during the session. It'll just take about a minute, and then we'll introduce our speakers. Can everybody see that poll?
Yeah.
Okay, so I'll give you about a minute to complete that. And if you just want to put your thumbs up once it's done. And if you scroll down, I think there's a 4th question as well.
Huma, do you want us to do it if we've done it before?
Yeah, you can do, yeah. I know that some people have attended the session on Monday as well. That's fine, Lindsay, thank you. I know that Zoom affects, you know, whether you can hear or see others, so that's absolutely fine. Okay. Right, so we'll share that poll again. There were 35 people registered to attend today's session, so I'm sure people will be joining as we go along this morning. So without further ado, I would like to introduce our first speaker, Shaheen Khosa, who is the Race Equality Manager for the Unpaid Carers Programme at West Yorkshire Healthcare Partnership. Welcome, Shaheen.
Thank you very much, Hummer. I've got people sending me messages that they're trying to join the webinar and they're unable to. So I wonder if Fatima could quickly send Anna Diani the link again, if she can, please.
We've just sent the link out again now to everybody.
Have you? Thank you very much. So I will leave it as that. I think what's happening is that NHS organisations, we're all very used to Teams, and Zoom is not something that we regularly would log into. So I think that's where the sort of issue is. But never mind.
Never
This
mind.
is part and parcel of joys of working hybrid and on a screen. So thank you for joining us today. I've only been quite newly seconded into this post, so I'm not an expert at all. But what I wanted to pick was one of the very first things, the definition of what a carer is. So the definition of a carer is anyone who cares for a friend or a family due to an illness. It could be a disability, mental health problem, or an addiction, and they cannot cope without their support. I think that's one of the things is that lots of people do not understand what the definition is of a carer. After understanding, or the lack of understanding of what a carer is, people don't quite want to identify as a carer because I am just a mother or a son or a sibling. So there is that as an issue as well. So what we'd like to unpick today is, if I give you some of the statistics, which Hummer kindly mentioned, that we save the economy, carers save the economy £132 billion a year. How much do Black, Asian and minority ethnic communities save the government? A staggering £7.9 billion a year. And it's in stark contrast to the investment that there is to support them. So that's something to think about. The demographic profile in the UK is rapidly changing, and so are our family structures. It is anticipated that the potentially increasing demand on working carers from Black and minority ethnic communities. This webinar, we've got some, and I would say expert speakers today, because they are caring for somebody that they love or have cared for someone they love. These are the people that we wanted to hear from, because you are experts within care and you are also working. Today, what I would say is that we have a chat bar. Please utilize the chat bar. I will be putting lots of links in. We've got lots of really valuable information for the Working Carers Passport, if it's something that you've not heard about, flexible working policies, the contingency plans. So really, I mean, I'm really delighted that Kes could be with us today, and I'm going to introduce Kes as our first guest speaker, as the Head of Equality, Diversity and Inclusion for Bradford Teaching Hospitals, to share his experience. And it would be really good if we can hear some of your recommendations. What would you recommend going forward? And what I would really like to hone in on is your own mental health and well-being. What has worked, where there's been gaps in service, and where we could make improvements. So over to you, Kes.
Thank you very much, Shaheen. It's absolutely fantastic to be here today, as Hummer said, and yourself. We often don't hear these stories, especially the personal stories. One, they are very personal to individuals. I feel, you know, my story is very personal to me. And, you know, I think being a carer comes with a bit of a price tag as well. And hopefully I can highlight some of that in my discussion, in my story really today. So just before I do that, I wanted to thank Race Equality Network. I wanted to thank the Unpaid Carers team in terms of the invite, but also for the fantastic work that we are doing around unpaid carers. I think, you know, the pandemic threw lots of negativity and lots of issues and lots of challenges, but it also presented lots of advantages as well. And I think when I was driving back home from work one evening, and on the streets of Bradford, I saw on the signs, you know, if you are an unpaid carer, please go get your vaccination. And it gave the time. So I think the pandemic has raised the profile of unpaid carers. And I think it's something we need to sustain going forward. And I think it's certainly something that we need to amplify further. Yeah, I just thought I'd start off with saying that. So 15 minutes is what Shaheen said I've got. To share a lifetime of a journey that we've been on, 15 minutes is not sufficient. Now, what I want to do today is want to very clearly talk about 3 different things. And that is the first thing I want to talk about is defining the role of carers from an ethnic minority background. And I think that's quite unique. I also want to give you my story. I want to give you an overview of the condition, and I want to introduce my son Hassan at this point, although he's not with us. But obviously, I'm going to be talking about Hassan, who is an amazing, who I am very, very proud of, who is 26 today. And he's on his way to Scotland as we speak for a 15-mile hike over 2 days or something, over so many different, heights of mountains, etc. So very proud of the young man that he's become today, despite his challenges and despite the issues we've had to face. And last but not least, Shaheen, I'm so pleased that you've talked about recommendations. Because events like this, for me, it's about the so what factor. What's going to happen at the end of these events after, us individuals sharing our personal stories and journeys. For me, I've got some very clear recommendations from my perspective and observations from my perspective as a working carer from an ethnic minority background, somebody who works full time. I feel there's some very clear things that we as employers could be doing now. Okay, so I'm going to start with defining the role of carers from an ethnic minority background. Now, I can talk for England and Pakistan put together. For those of you who know me, I know that will be nothing new for you. So please keep me on track, although I've got 2 different stopwatches going off here, but I can soon ignore them, once I get into it. But I will do my best to keep on time. So defining the role of carers from an ethnic minority background, I've been a carer ever since I've sort of grown up and been a teenager. I've been a carer to my mother. I've been a carer to my father. It's something that is seen within my religion, within my belief, within my culture. I have a role, I have a responsibility as a father, as a son, as a brother, to be there for those individuals who rely on me, because that's the expectation in the South Asian community. Certainly, I come from a Pathan background. I have parents with very traditional values, but very strong values as well. So I've automatically grown up in an environment where them caring responsibilities, respecting my elders was absolutely paramount, and it run through our house on a daily basis. So when Hassan was born, basically, obviously that responsibility as a father was already there, because I knew that as a father, I've got a responsibility for my son in terms of caring for him. But at that point, I did not know that actually the things that are going to be thrown at us as a family in terms of the complications that Hassan and we experienced in terms of when he was born was absolutely life-changing. So I'm going to talk a little bit about what happened and what the condition is that Hassan got. So in 1996, when Hassan was born, when he was about 3.5 months old, it became very apparent to us as parents that actually there's something not quite right about Hassan and the way he's interacting with us, the way he's viewing objects, etc. So we got in contact with the local midwife, etc. And, that was our journey where it began in terms of accessing healthcare. And to our real disappointment, we were told after when Hassan was I'd say he was about 18 months old, when he was diagnosed with a visual impairment. So his vision was so bad that he had to be registered blind. So as a young 24-year-old, new father, that was a big smack in the face at the time. And I was working for Bradford Council at the time, and the things like the internet was just about to raise its head. And, you know, it was I didn't have internet at home. I remember, you know, the day we went to the hospital, and the doctor here at Bradford Teaching Hospitals, when he diagnosed my son, it was like the world has just, you know, erupted from underneath our feet. The terminology, for example, that was used to diagnose the visual impairment, by the time I left the room, I forgot. I wasn't, you know, I wanted to know the impact, the implications. So right from them early days, you know, I was faced with a lot of barriers, lots of challenges. And I remember ringing the secretary the following day and saying, actually, Dr. So-and-so diagnosed my son to be registered blind. I forgot the name of the condition. I forgot what he said. Can you please put it in writing and send it across to me so that I can do something with that information? And that's when my journey of a carer really actually began, with the challenges that I was faced with. Now, that was just the beginning. That was just a real small beginning in terms of being diagnosed with a visual impairment. So if you can just imagine the impact of that for myself in terms of my mental health, you know, the fact that we've never ever in the family ever dealt with a disability, never mind visual impairment, there was a lot of impact, implication. Hassan was sort of 2 at the time, but then there was the whole world of school, etc., that we had to think about. Would Hassan be going to a mainstream school? Would he be going to a specialist school? I remember at the time there was the whole every child matters agenda, and I was an adamant father who was really adamant that my son needed to be in mainstream provision. And I remember even today where certain head teachers turned around to us and said, there is no place here for Hassan in a mainstream school. And the reason why I'm mentioning that, for a head teacher to turn around and say that to a parent who's very early on dealing with a very early complicated diagnosis, but who was I was already working in the field of equality. I was very early in my career working for Bradford Council. So all of this information was fairly new to me as well. And one of the first support I got from my employer back in 1996, and that was Bradford Council, that I was allowed to stay at my desk from 5 o'clock to 9 o'clock because there was internet was available, and I was able to do research on the condition that my son was diagnosed with. So the support that I was able to achieve, you know, getting in contact with parents from across the world who'd been diagnosed with a condition called cone dystrophy. So cone dystrophy is when all your rods and the cones at the back of your eye are completely not working. The colour you cannot distinguish. Things are in black and white. So initially when Hassan was born, he had limited vision. He was accessing fonts at 0.14, for example. Now, unfortunately, in 2015, there were other complications started to stem up, which then further concerns were highlighted. Now, in 2015, I thought the initial visual impairment diagnoses were life-changing, but unfortunately in 2015, we were told that Hassan's got no vision because actually Hassan actually has been born with a very rare disease, life-threatening, life-limiting condition called Alström syndrome. I get quite emotional at this point, but I promise you I won't cry. But it's a personal story and I've not shared it for a long time. And this is why I think it's important to really understand these personal stories in terms of the impact and implication. So in 2015, I got a call again from a specialist from the hospital that I'm currently working in to say, can we please bring Hassan in for a blood test because we feel he might have a condition. So between around about 2014, Hassan began to get complications with other aspects of his health, i.e. diabetes, issues with the liver, his vision, he completely lost in 2015. So one morning he woke up and said, Dad, I can't actually see anything. things have gone very dark. And that's when we knew that actually there's something more major happening here. And Hassan was diagnosed with Alström syndrome, which only 700 people in the UK have this condition. It's a very complex condition. It affects the vision, it affects the hearing, it brings diabetes. It's a condition which, there's no mechanism there to break, to deal with obesity, for example, and then eventually it attacks one of your major organs, and that's why it's life-threatening and life-limiting. So for me, that was a time and a real worrying, real concerning time where I actually sat back and thought, this is the end of my career. I remember at the time, in 2011, I was graduated with a master's degree. I was very ambitious. I wanted to work in the Middle East. I actually got two interviews with Qatar Airlines at the time it was, as their head of organizational development. And I was really wanted that job. But in the meantime, I was faced with such a tragedy at the time, and it did feel like a tragedy, that I thought, no, my son requires me, and I need to be at home to be able to support my family and my son in what circumstances we're going to be thrown with, because it was all very, very new. So obviously that was very life-changing. What helped me at the time, because obviously I really did think I'm going to have to stop working here, but having open, honest conversations with my manager, I suppose. My manager sort of knew at the time I was working at the university, at Bradford University at the time. So for me, the relationship with my manager was absolutely paramount. Having them open, honest conversations with my manager were absolutely crucial. Things like compassionate leave in organizations, things like flexible working in organizations, things like inclusive leadership, compassionate leadership were the things that I needed, were the things that I required. Because my other option was actually to jack it all in and stay at home. And I really did not want to do that. And at the time, I remember my own mental health was at ground zero, because I was dealing with complexity. I was dealing with traditional parents as well, who I had to break this news down to. My partner, who is from Pakistan at the time, did not speak English. So it was very difficult for her to join me at consultant appointments and to understand the impact and the implications. So the pressure on me as a carer was immense. It really, really was. But for me being me, and I had to very quickly bounce out of the negativity that I became, the bitter, the angry man that I was becoming. That was really important for me to really get a grip of how am I going to deal with the complexity and the challenges that I'm faced with. So even now, my son refers to it about, when Hassan, it was really important for me and Hassan to be really mindful of our behaviors, of the way we are feeling. I've used words like bitter, angry, upset. And I was finding earlier on in the days when I was having to face with multidisciplinary organizations, developing a care plan or an educational plan. And when I was seeing levels of resistance and that lack of support, I mentioned earlier, I had head teachers who said to me, you know what, Kez, there's no place for Hassan here. You're going to have to go to a specialist school. And in Bradford, there was one specialist school at the time for visual impairment, which has since closed down. So for me, with the work that I was doing, for my own personal knowledge that I had, it was about, hold on a minute, there's something here about my own faith and my own religion. And that was something that I held on to. because that was something that was really helping. There was something about my own personal resilience. There was something about how I'm dealing with my resilience and how I'm dealing with the impact of what I'm having to deal with. And believe you me, being knocked from pillar to post, dealing with government departments and dealing with education departments and schools and head teachers, and, you know, fighting for the support and fighting for the provision that you as an individual strongly believe that your child is entitled to, can be a complete different ball game when you're at the other side of receiving all of that. So I feel as though majority of my life I've battled with organisations, but what I've learned through that time is that actually my own personal influence, being solution focused, yes, hit with lots of challenges, but through my lived experience, what solutions can me and Hassan provide to others that we are working with? And that's been a real game changer for me and Hassan. And even now, Hassan, you know, we came up with the terminology, and he uses the phrase professional rollicking. And the reason why he uses that term is because we both had to be really mindful that actually, Hassan, kicking off in a meeting or being angry and being bitter is not going to help. As I said, being a carer comes with a price tag. Being an individual with a disability or a complex health condition comes with a price tag. So for me, it was about how can I influence, how can I help others so that they do not have our experience. And I'm really pleased to say that through all of this, I've been a parent governor. I've been an advocate for many parents. I've been an advocate for many Asian parents who have no English language skills and who are having to battle with schools and departments in getting their plans and getting the needs met. So for me, the turnaround in terms of how I deal with all of this is how can I help and support others through my own lens, through my own experience. So I'm really pleased that, you know, with the condition that Hassan has got, I'm a director on the board for that voluntary organisation. And from starting that charity, from a front room, from parents who have now lost their children, that charity is now a global charity where we are working. And my role on the board is being a specialist as an EDI, but also being a parent director, advocating for other families who have Alström syndrome UK. So that personal resilience was really, really important, remaining positive. Absolutely key. And remaining positive was that I had trust in my faith, in my Lord. I had trust in my religion. You know, there was a time, a very, very difficult time when I actually, Anila, I think I might have shared this with you before, but 2 weeks in role working at Yorkshire Ambulance Service, my son, you know, despite all of this that's going on for him, he decided to have a mental breakdown, which came from absolutely nowhere. And again, the impact of mental health and a carer and the work that I had to do with people in Linfield Mount and case studies and being a real advocate in saying, no, medication is not the best thing for my son. There's alternative therapies and alternative treatments. And through developing case studies and battling with some of the consultants there who were adamant that my son had to be on medication for 2 years, which was having a knock-on effect and an impact on his other health complications as well. So I think I'm hitting my time. I want to finish off by saying what really helps a carer in employment. I think there's something about employers amplifying the culture of carers in their organisations and recognising that individuals and colleagues who are coming into work are carers and can be carers. And I think there's something about how we amplify the voice of carers in our organisations. I think there's something about increasing our comms and engagement with a focus on carers is absolutely paramount. Some of the work that the partnership has already begun on, I think sustaining that and building on that momentum is absolutely key going forward. We often talk about inclusive, compassionate leadership. I'm really fortunate and I'm really privileged that I've had some very inclusive and compassionate managers. And that is a two-way relationship. My relationship for each of my employers, even at Bradford Teaching Hospital, has become a give and take relationship. You know, flexibility. So when I have to take my son to annual appointments to the Queen Elizabeth Hospital in Birmingham, because that's where the multidisciplinary team, that requires a 72-hour admission. That requires me to go with Hassan. So there's often when I've got my laptop out at the side of his bed, when I know I can be still getting on with my emails. If I have any reading to do, I can still be getting on with that reading. So I'm not abusing the system, even though that support is there. There's lots of flexibility there. It's absolutely crucial for individuals to be open and honest about what that need is. I really welcome compassionate leave policies. I really welcome the passport, the carer's passport. I still believe there's work to do in how we raise the profile of the carer's passport, management and leadership understanding in what our colleagues might be going through in their private lives is really, really important. And I think, you know, the promises that we give and the promises that we deliver in our organisations around health and well-being is really important, that the carers are absolutely mainstreamed within their messages. Flexible working, every organisation has a flexible working policy. How are we aware of such flexible working policies? How do we develop our business cases so that we can utilise and benefit from such policies? And in my case, as I've already said, through such policies and through such information, I was able to remain in work. Even today, you know, I am in work. I've had multiple caring responsibilities, not just for my son, my mother, my father. You know, this is not pressure, because as I said, I don't see it as any pressure. I see it as my role. I see it as my responsibility. I have faith in my religion. I know I get a variety of you know, faith and peace through providing my caring responsibilities and my caring roles, because that is my belief and that is my faith. And on that note, I would like to say thank you for listening to my story. I hope you found it informative, and I'm happy to take any questions.
Thank you, Kez. That was really inspirational. I myself am a carer, but, you know, hearing your personal experiences, you know, have really hit home today. And I would just like to open the floor up for any questions. Would anybody like to ask Kez any questions? Shaheen?
So, question for you, Kez. Something that I know too well within South Asian people and perhaps the wider ethnic groups, we often have lots of hidden traumas and we don't talk about our hidden traumas. Can you tell me that with everything that you've been through and perhaps are still going through, what has been the to-go place, or where do you think that the place that you would go where you'd say this is really helpful, or this, or where you think this is where we could actually get help from? Because that's what I find at the minute, that there is a little gap in the service. That's for me personally, in terms of counselling support. What does counselling support look like? For you, I'm just asking, very personal, if you want to answer it, you can. What do you think is the most helpful thing in terms of your own health and well-being? You're on mute.
Yeah, really good question, Shaheen, thank you. I think for me, for my own health and mental health and well-being, one key thing that became quite apparent was that my focus on helping others became really apparent about, and I was obviously, you know, getting lots of benefit from that, but also to keep my own self, you know, at sanity. I think keeping healthy, you know, having a run around the block, joining the gym, I really needed to, on a daily basis, had to shake things off. You know, mental health is quite unique, as we all know, and it affects us all very, very differently. So I was seeking support from helping others, and I think going to the gym, just keeping that physically active was absolutely paramount. And it's something that I've had to just continue with, you know. So every other day I will have a good run, or I will go to the gym. I'll just, you know, really need to shake things off, which I think really helps me, you know, with my health in general, but more importantly, my mental health.
Thank you.
Thank you, Kez. Thank you. Does anybody else have any questions for Kez? Shaheen has kindly put some links in the chat box for some support, and you know, I know that it was Carers Week last week, and West Yorkshire Healthcare Partnership had a wealth of information around support for carers, unpaid carers, and any information that you might require. So thank you so much, Kez. And please
Anita
feel
had a
free.
question.
Oh, sorry, Anita.
Oh, Kez answered my question when
Oh.
Shaheen asked her question. Thank you.
Okay. Thank you. So yeah, please feel free to put any questions that you might think of later in the chat box. So now I would like to invite our next speaker and introduce Elaine Powell, who is the Carers Lead and Carers Champion for Adult ADHD and Autism Service in South West Yorkshire NHS Trust. So welcome, Elaine.
Hi everyone, thank you. I'm just going to share a little bit of my experience as a carer, which spans a long period of time actually. I became a parent carer going back about 35 years ago now, and although I do less caring now for my child as now an adult, I still help to care for 3 elderly people that I know that are in their 90s and one in their 80s. So I take them out and check on them most days and cook food for one of them on a regular basis. Sometimes I go and visit, keep them company. I have regular conversations over the phone with them. During lockdown, there were times when they all felt a bit lonely and a bit down. So I tried to keep their spirits up as well. I also used to help care for an uncle who was severely disabled, and unfortunately he died last year. But like many carers, I don't really see it as caring. I just see it as looking out for others who need help and support. I also work full time, so this is quite tiring for me as I get older and I have my own health issues to deal with. As carers, we often put ourselves last, and this can affect our own health and well-being more than we realise. We often don't look for support for ourselves, as we are always caring for others and put them first, especially if this is your child or is a family member. When I first became a carer, it was really hard work. I was caring for a child who had neurodevelopmental conditions. These are ADHD and some other conditions that sit on the autistic spectrum. Also have comorbids, so more than one condition combined or coexisting with that. I realised there was no help or support available for either medical diagnosis, interventions, educational support, support from the LEAs or any respite at all. There was a lack of education and awareness amongst professionals within teaching, health and social care backgrounds, and therefore hard to get a medical diagnosis or support. The condition and its comorbidities were not recognised at that time. So not only was there no support for my child, but there was no support for me as a parent or a carer. The impact on my health was massive. I was 24 hours caring with no sleep. I was tired, I was exhausted all the time, and found it hard to function day and night without rest. I had no social life, I didn't see friends, I had no family support. No one seemed to realise what I was going through. I felt no one really understood. I didn't know where to turn, as there were no help. No help seemed to exist at all at the time. I also felt, as a parent, it was just my duty to care for my child, and it was my responsibility alone. I did not realise I was a carer, or that I should be getting some support. I just thought I was a mum, and that's what mums do in this situation. I was just told there wasn't anything anyone could do. There were no services, and we didn't fit the criteria for help. As these conditions affect behaviours, impulses, and activity, you feel people judge you as a parent like it's your fault your child is displaying these conditions, and not a valid medical condition, which it is. There was no one diagnosing this condition for a long time, but eventually, after 7 years, we got a referral and a diagnosis was made. But there was still no wider support available. Even the consultant had not diagnosed anyone before. So that was the situation at the time. There was also the cultural aspect. I didn't really come across anyone else in the same position for many years, and definitely no one from my own ethnic background either. I think there was a lack of understanding culturally about these conditions as well. So I felt isolated and alone. Sometimes you feel you are neglecting responsibility as a carer as you need to work, and you can feel guilty. Culturally, there are things that are expected of you, and you don't really question it. We tend to take on the responsibility of looking after our elderly parents or grandparents, looking after family members or children that have illness or disability. Sometimes there's a lack of awareness of the support that's actually out there. I think services need to reach out to diverse communities. I also think services should be more culturally aware, and they should also represent the community in which they serve. As I've said, the impact on my own health was massive. I don't know how I coped when I actually look back now. I don't even know how I coped at the time. My mental health was really suffering, but no one seemed to care about that. No one ever asked how I felt or how I was managing. Until one day, I was speaking to someone on the phone. I'd been advised to contact about my caring role and finding support for the person I cared for. But this person asked if they could ask me one more question before ending the conversation. And they asked me who was looking after me. And this stopped me in my tracks, as I did not know what to say. No one had ever asked me about me in all the years I was caring for my child. No one was looking after me. So this person said, if no one's looking after you, then how can you look after someone else? You need to look after your own health and well-being. This person was someone I know as a boo and works in our trust, actually. He was the first person to ask me about me and not just the person I cared for. And it's something I've never forgotten. I always ask carers, who's looking after you? I spent many following years sitting in meetings with various professionals from health and social care and education, but I was getting no real help. So I started fighting for services and attended NHS trust-wide mental health meetings, asking for a service to be developed. I attended regular meetings for over 8 years before they agreed to pilot a service for ADHD and later autism. I was on the implementation team, but by the time all this was done, my child was an adult and had little in the way of real support. By this time, I had helped to set up support groups and met other parents. Meeting other parents who was experiencing similar things helped, and we were all fighting for the same thing. But I also faced racial discrimination from some parents, even though I was the one fighting for services for everyone, and I'm from an ethnic minority background. On the other hand, I met a fellow parent carer almost 30 years ago now, and we are still good friends today. Although we lived in separate towns, we supported each other emotionally and in raising awareness amongst professionals. Things did improve. After my years of fighting, Swift NHS Trust implemented a service for adults with ADHD and autism, and I was on the implementation team for that. This was the first service in the UK properly run under the NHS, and someone was given the substantial role of heading of that service. So we actually interviewed them for that post, and they're still in post today. The service is still running successfully 13 years later, and for the past 16 months, I've been working for the service, and I can see how much has been put in place since I was looking for support myself 35 years ago. I'm a carer lead and carer champion as part of my role, and I support carers involved with the service. I can understand what they're going through as I've been there. I know what they need, I understand their struggles and concerns, I have the lived experience. So Swift NHS Trust are a carer confident employer. So we have a carer network, carer champions and carer leads, and lots of good work is being done for carers in the trust, which is good not only to see, but to be a part of. The network is passionate about supporting carers. I have helped to develop a carer pathway for the service, and I wish something like this had existed when I needed the support myself. In fact, I use my caring experience to help implement services for others in the same position is something I am proud of. This work started from me being a parent carer and spans a 35-year period. Over the years, I've educated others, including parents, carers, professionals, teachers, medical practitioners, etc., and continue to raise awareness of these conditions and the support needed for carers. Although I became an academic and an expert in this area later down the line, I did not receive any recognition for my work until recently, when I was nominated for an award by the chair and executive directors of Swift NHS Trust, who felt they needed to, I felt that I needed rewarding for my efforts for all those years. And I actually received a British Citizen Award, Medal of Honour, of which I'm very proud to have received. So that's about it for my story.
That was so inspirational, Elaine. Thank you so much for sharing your personal experiences, and congratulations on your achievements as well.
Thank you.
It sounds like it's not been an easy journey, as it's not for carers, which are often overlooked by the system, because you're right, nobody thinks about our mental health and how we're feeling as carers, and this is our final webinar this week, and we've had that throughout the week from other carers as well, and they've really appreciated that this is a platform where they can share their lived experiences and really get support. So, you know, it's Make a Friend Day today, so we're hoping that, you know, this will open up a pathway of you getting to know one another as carers. So feel free to share your details in the chat box and connect, which is brilliant, and that's what we love to see at the Race Equality Network. So thank you so much. Does anybody have any questions for Elaine? Gillian's put excellent forerunner for all patient carers. So pleased you were rewarded. So yeah, so that's a message for you, Elaine, in the chat box from Gillian. Thank you, Gillian. Thank you. Shaheen's got a question for you.
I think Anila put her hand up as well. So no, you didn't.
Anila, I can't see you putting your hand up. I'm so sorry. Go on, Anila.
She said she would.
No, I wasn't. I was scratching my face.
Sorry.
It's all right.
So,
all right. Okay.
This question, Elaine, this is for you. Anila, I know you haven't spoken yet, and you work for Yorkshire Ambulance Service, so it's also for you and also for Kez. So you're all working within the National Health Service, and my question is, what kind of support do you have within your services which actively promotes working carers? So I'll ask you that first to you, Elaine, and then I'll come to Kez.
So I'm pretty new to the NHS. I've only been here 16 months, and it's something I've only learned since coming into the actual trust, that there is a massive carer network, and there's a network for people that work in the NHS, like working carers, and there's sort of different networks. I work within just my service, and so I get support from my line manager, who's always asking about my health and saying that I need to look after me, because she's very aware that I'm always doing things for other people, and that, but I'm, you know, the caring that I do now, and a lot of people don't really know about that in the trust. So my story is more about my journey as a parent carer, and the people that I care for now. Again, I fall into that same category where I don't see it as I'm caring. I'm just helping people and supporting people. But I know there is a massive network in our trust for working carers, and we're working on that even more. And the Trust looks at working carers as a protected characteristic, really. And they do have carers passports in the Trust. And one of the things I did when I came into the Trust, I heard everyone talking about these carers passports. I didn't know what that was. And I made sure that when I got my carer pathway up and running, that I put a pack together for carers, and carers passports were in every pack. So all my carers got those as well. And I know those are available in our Trust.
Thank you. So
Thank you, Elaine.
just in terms of asking the question, because Kezia looked a little bit shocked, the question is, how do trusts or your work organisation identify carers, and what do they do in terms of promotion? And one of the you've answered it, Elaine, in terms of your organisation, Southwest Yorkshire Foundation Trust, in having the working carers passport, having a carers group was fantastic, and we'd like to see that across the board, whether it's in the NHS, we're talking about it in the VCSE local authority sectors as well, to have these support groups. So can I ask the question to Anila first and then come to Kez?
Yeah, absolutely. I'm going to touch up on a little bit of it when in my story as well. But yeah, Yaz have a very effective group sort of a workout where we have got various groups for various issues that people have. We've got disability groups, we've got carers groups. I'm very, very lucky that throughout my life with Yaz, I've had good managers, good team leaders, and they've understood what the needs were, my needs were at that time, and helped me through those. On a bigger picture, maybe it wasn't so, but as time has gone on, the organisation, with the work that Laura's put in over the past few years as well, has really picked up at the bar. And we do have a lot of involvement and conversations, open conversations with people who we need that help from as employees. Again, having a really good duty manager, having a really good team leader, somebody who understands that family life can be complicated, somebody who understands that it's difficult to balance home and family sometimes, who understands that there's not just one aspect of our lives. Our lives can have 20 different spikes coming out of them. If you consider the life as a ball, but 20 different spikes coming out of them, and some of them can be quite painful. Those people are there, and they have been extremely helpful to me. And I will elaborate a little bit more when I tell you my story.
Thank you, Anila. Kez, do you want to answer Shaheen's question? And then we had Gillian, who had her hand up as well.
Yeah, can you just repeat your question, please, Shaheen? Just so I'm not giving you a waffled answer. I want to make sure I give you the right answer.
So the question, Kez, was that what is your organisation doing in terms of, and I bet you my question is going to change now, because I have got that small of a memory. Okay, let's make it very personal. What is your organisation doing in terms of identification of carers? What kind of support is available within your organisation?
Okay, that's great.
I think we'll leave it as that, yes.
Yeah, okay, no. Okay, thanks, Shaheen. So in terms of my organisation, there's focus in the organisation around raising the profile of the carers passport. And I really welcome that, because obviously it's a collective, wider ICS initiative. I think it provides consistency, and I think it also allows us to raise that profile. So with the wider work we're doing around disability equality in the organisation, we have aligned carers with the Disability Staff Network for now, and that is the association with disability and the association of maybe managing a long-term health condition. And we believe that that is going to be an avenue to help us explore. But as the head of EDI, I would be really keen, and maybe this is a recommendation for me to go back, I would be really, really keen to develop a place-based carers network for Bradford and Craven. Let's be the game changers in this. you know, let's bring in the representation from all our organisations across the place and see what powerful that network could be, but not assigned to an organisation. It has to be place-based approach. I hope I've answered your question there, Shaheen.
No, that's fine. And the network, are we talking about it for ethnic minorities or carers per se?
Let's think of the whole notion of inclusion. And I think, yes, even though there are some unique impact for ethnic minorities, I think it's about bringing everybody in. We all have lots of common areas. Yes, we may have our differences, but this is about, you know, some of them key areas that impact us all, regardless of our ethnicity or anything else in that matter. So for me, it would be a wider inclusion carers network.
Yeah, I agree with that, Kez. Very valuable points from yourself. There needs to be more that's done on the ground to support working carers from all ethnicities and backgrounds. So maybe something for you to take back, Shaheen, as well. Yeah. Okay. Thank you. Thank you, everybody. Can I bring Gillian in? Gillian, did you have a question for Elaine?
No, it wasn't a question. I just wanted to thank Elaine for identifying the support that we have at South West Yorkshire Trust, and the value that brings for actually highlighting that, because that helps to disseminate it. Do you know what I mean? And that we know that, you know, at the trust we've still got work to be done, but it's brilliant that, you know, that people are accessing, you know, that the staff carers network, of which I'm chair, so that's why I'm quite passionate about it. Do you know what I mean? So I'm just brilliant. I'm just really pleased that Elaine's highlighted those things. So I just wanted to thank her.
Brilliant. Thank you, Gillian. Thank you for joining us today as well.
Thank you, Gillian. Oh, thank you, Gillian, and yourself and Abu, fantastic carer leads for the whole trust. So you do great work, and they've actually got awards through the work that you've done. So that's fantastic. So of course I'm going to highlight that.
Thank you. Thank you.
We're all award winners here today, aren't we? It'll soon pass. It'll soon be 2023, and there'll be dust on it. But hey ho. But thank you.
Thank you.
Thank you, ladies. Lyndon has put in the chat box, great idea, Kez. Could really help any organisation to see good practice elsewhere and pinch it. We're all here to work collaboratively. So, Shaheen, if you want to put your details in the chat box, I'm sure, you know, people can reach out to you and look at how you can develop this service for the whole of West Yorkshire. So thank you, Elaine, and we'll move on to our final speaker this morning, Anita Emma, who is working for Yorkshire Ambulance Service, and Anita will now kindly share her experience of being a carer since the age of 10, I believe. Anita, so welcome.
Thank you, everybody, and thank you for allowing me to come and speak today. Laura said, short notice, do you want to do it? And I says, well, absolutely. And I think it's quite important that we share what we've gone through. Maybe that can help somebody else going through maybe same or similar, even if it's a conversation, you know, that helps. So I'm going to be reading from some pages that I've written. I suffer from a condition called Fibromyalgia Syndrome, and I've been having a bit of a relapse this week, and I've got a little bit of a foggy memory. So I wrote everything down because I didn't want to forget what I wanted to share with you all. So my life as a carer, unbeknown to me, really started when I was maybe 8, 9, 10 years old. When I went to stay in Pakistan with my mum and my 4 sisters, and that's going back to 1975. I'm showing my age now. Mum wasn't very well at the time, and she was struggling with a change in our circumstances, and had a lot of other health issues as well. So as our stay extended, my responsibilities grew. I was the eldest child. I was the eldest daughter. I was helping in the cooking and cleaning of our home, making sure that my sisters had their homework done, making sure that mum had taken her medication, looking after my granddad who had moved in with us. He was elderly himself. And along with that, making sure that I was going to school as well. I just got on with it. And at the age of 14, I realised that things were really difficult at home. Finances were very tight. We basically were poor. We suffered quite a lot of poverty in a new environment, away from everything that we knew and loved. And I had to learn to do things differently. So I started to sew clothes for people to earn some extra cash. And this was my way of helping to pay my own way and look after some of the household bills and make sure that my sisters were catered for. And my sisters were still at school at this time, and I was still at school at this time. But I was very good with my needlecraft and my sewing and my hands. So that helped quite a lot towards paying for my home, paying the bills, putting food on the table. And as I continued to do that, I supported my family up until the age of 18 at that point. There was no one to help me or guide me. I was Appa. If those of you know what Appa is, Appa means eldest sister. I had 4 sisters who looked up to Appa, and Appa just had to get on with it. Appa just had to be Appa and get on with it. Just before my 19th birthday, the family decided to return to the UK. It was a joyous time for us because we've been wanting to do that for a long time. Incidentally, just to let you know, in 1975, when we went to Pakistan, we went away on a 6-week holiday and we never came back again for 10 years. That was a very, very difficult period in our lives as daughters, as sisters. We just left everything. We went on holiday and never came home. So just before my 19th birthday, the family decided to come back to the UK. And I said it was a huge decision to make, financially and emotionally as well, because we'd made friends there over the 10 years. But we were happy. We were coming back home, and we were coming back to our dad because our dad was still in the UK. He never joined us in Pakistan throughout that time. So in 1984, we came back to the United Kingdom. So those 10 years, living abroad, living in Pakistan in the circumstances that we were living in, and the environment that we lived in, and the family dimension that we lived in, were most definitely very, very difficult days for us. So by the time we'd come back, we were aware that Dad had some health conditions and some health issues. He'd become quite unwell. He had a heart condition. He was due to have heart-lung transplant. Now, inadvertently, I'd had the duty of not just looking after my mum, but my dad as well. I put aside all my own ambitions. I wanted to be a doctor at one point, and I wanted to be a barrister as well. I wanted to go to university. So I put aside my aspirations and my ambitions of any further education to support the household and my parents. Hence, I started working, and I was holding down sometimes 2-3 jobs at a time, just to make sure that I was not putting any further burden on my dad, who at that time couldn't really do anything because of his ill health, and mum wasn't educated enough to do anything out of the house. She was a good seamstress as well, and she had taken it upon herself, despite her own health challenges of having chronic asthma, that she wanted to sew teddy bears at home. And that itself took a detriment to her health because of the fibres that she inhaled during that process. It made her more sick. And this was something that it really, really upset me and grated on me, that she was doing this because she felt that she needed to do her bit to share the care at home, whereas I wanted to be the one to look after her, not the other way around. So part and parcel of my role as my carer at that stage was, as I said, holding down my 2-3 jobs at a time, doing the shopping, taking mum and dad to their appointments, doing school runs, parents' evenings. I wasn't their parent, but I was still doing parents' evenings for my sisters. And these were all part of my duty as the eldest daughter, as their appa, as mum's eldest, dad's eldest. And I just got on with it. I didn't know any different. I just got on with it. Dad sadly passed away in 1985 at the very young age of 47. In his absence, all of a sudden, within minutes, from watching my dad stood reading a newspaper to falling to the ground in cardiac arrest to doing CPR on him and not being successful, I'd been jolted from just being the daughter now to being the head of a household. And that became my role for the up until now, I suppose, in a sense. This was culturally expected from me. I was bound by duty to look after my family because now we no longer had dad. It was just me, my mum, my sisters, and it become part of who I was now, my new role. In a sense, I'd taken over dad's role. So now I was responsible for looking after mum. I was responsible for looking after the home. In 1997, I started working for what was then the West Yorkshire Metropolitan Ambulance Service. I did mixed shifts for YMAS at that time. I did earlies, mids and late shifts. Again, I just had to get on with it, didn't I? I had to find a good job, which, you know, would pay me good wage so I could look after the home and just get on with it. I just wanted to be a good daughter. I wanted to be a supportive daughter and a sister. So I just got on with it. In 2001, Mum passed away following a very short illness. There was a house fire in the house next door. And even though the fire hadn't come into my mum's house, my mum was affected by the smoke from the house fire. And smoke inhalation exacerbated her chronic asthma. And one day she went out, it was winter, she went out, she came back home by taxi. She felt unwell in the taxi. And the taxi driver said, "Auntie, I'll take you to hospital." And she said, "No, take me home and call my daughter and she'll come and take me to hospital." I got a phone call from a random stranger saying that I'm at your mum's house, dropping her off, and your mum's become really ill and she wants you to come up. So I literally jumped in the car, drove up there. By the time I'd got to my mum's, as soon as she saw me, she just collapsed off the sofa onto the floor and went into cardiac arrest. Now, at that time, I was already working for the ambulance service. I had extensive training, proper training of how to do CPR. Once again, flashback, I was on the ground on my hands and knees, pumping my mum's chest, willing her to breathe. And unfortunately, it didn't happen. She did not survive. She passed away right there in her own home where she wanted to be. It was her home, it was her space, and she passed away. Losing mum all of a sudden left a massive hole, I say, in my daily routine, because where I no longer had the care of her anymore. Up until then, I was taking her shopping. We were spending a lot of time together. She was babysitting my daughter while I was working. So things changed in a massive way. To those who looked in, there wasn't any change at all. But to me, there was a massive change. I had now taken on not just the role as the father, but as the mother for my sisters as well as being mum to my child as well. So my role had grown all of a sudden. The umbrella of my role had grown. So it was a huge hole to fill, not having mum there anymore. And how did I fill it? By working some more and working full time. I involved myself in community work. I literally threw myself headfirst into doing whatever I could do, you know, in the neighbourhood, if it's street parties or cleaning or filling in forms or writing letters for people or anything, you know, I could do to fill the extra hours. I was doing that. At the same time, I was looking after my daughter, looking after my own home. With losing mum, I had a bit more of an opportunity to spend a little bit more time with my daughter, something that I wasn't really able to do fully when mum was there, because she needed a lot more of my attention at that time too. I started working permanent nights because mum was my carer for my daughter, and her no longer being there, we had to make that decision. Do I quit working and stay at home now, or do I find another way of working? And I was very lucky that my duty manager at that time sat down with me and we worked out a rota where I could work permanent nights. So those of you that don't know, since 2001, I have worked permanent night shifts with the ambulance service. I don't do day shifts at all unless it's I'm swapping a shift with anybody, but I work permanent nights. And nights for the ambulance service bring their own challenges, as Kez will tell you. Around about 2013, my elderly mother-in-law started suffering with her health problems. We had a really good relationship because after mum passed away, she was my mum. She was my friend. She was my confidant, somebody I could sit and talk to for hours on end. We had become even more close since mum's death. So I spent a lot of time with her. We spent a lot of time talking about old times. My mum and my mother-in-law were really good friends as well. So it helped me having her there, you know, just somebody who was a motherly figure, but she was my mum as well. You know, she was on me. My mum was mum and she was on me. She became quite unwell with diabetes, and she developed a heart condition, which progressed on to her having kidney failure. And for a couple of years, myself and my partner used to look out for her in her own home because she was fiercely independent. we used to visit her maybe 2, 3, sometimes 4 times a day, making sure that she had everything that she needed in her own home. She wasn't needing for anything. That she'd cook some food, she'd had something to eat, sit down with her, have a cup of tea, spend 5 minutes here, 10 minutes there in between running about. And that was quite a large part of my life again now. I'd started that role inadvertently as the daughter-in-law, but then became mum's carer. So if you see how it's progressing to be, from being just a daughter-in-law to being now somebody who's looking after mum because of her needs. In 2014, mum wasn't able to live on her own anymore because her health had deteriorated so much, and we'd been asking her for years to come and live with us, and she decided she was going to come and live with us. And in a sense, that was one of the most happiest days of our lives, because we'd been begging her for years and years and years, please come to us, please come and live with us, let us look after you the way you've looked after us, all these years. And she wouldn't have it. She was so independent. She just wanted her own space, her own life, but she decided, and we were so happy that she was coming in to stay with us. Obviously, my daughter, to have a grandma there, to have a daddy there, it meant a huge, they were very, very close to each other. And mum's health and me's health at that time had already taken a turn for the worst, and she was under the care of the dialysis team, and we were now dialysing her at home on a daily basis. We were a family, and it was our duty to look after her. Never considered myself to be her carer or my mum's carer. I always considered it as my duty as a daughter, as a daughter-in-law. And as Kes said, in the Asian, the Pakistani culture, it's our duty to care for our elders. That's how we're brought up. That's how we're programmed. And I use the word program because when I was a little kid, I was always told, if anything happens to, your mum, she falls ill, you've got to look after her because you're the eldest. And that's what we did. That's exactly what we did. So it's, recognised as a responsibility of the family to look after them. It was my responsibility to look after my sisters as well, being the eldest sister, being the Abba of the family. And that's how it stayed, and it still is now. Sisters are very independent, but I feel it's my duty to still watch over them, to make sure they're okay, that they're not needing for anything. My sister's not feeling, one of my youngest sisters is not feeling very well at the moment. She has got bad health issues with her kidneys. So I ring her every day just to check up on her, just to make sure that she's okay. She doesn't need anything. Again, inadvertently, I'm caring for her, but I'm an Appa. It's my duty to care for her that way because she's our baby. And that's the way I see it. In 2015, unfortunately, mother-in-law was hospitalised and sadly passed away after a long stint in intensive care. Once again, during that time, we found that we were there providing her care, even though the nursing staff were brilliant. We were there providing her personal care because that's what she would have wanted. And that's what we wanted as well, because, again, it was our duty to do that. She'd looked after us, and it's our turn to look after her in her time of need. Now, working nights helped me as well. I was able to spend my days with mums, both the mums when they were with us, and then go to work at night, handing over care, especially of me, of mother-in-law, to my daughter and my husband, and made sure that they were properly catered for before I went to work, that they didn't need anything while I was away. I was only a phone call away, and Yaz were very good. If I'd got a call from home to say, mum's dialysis isn't running very well, or she's had a turn, can you come home? They'd say, right, get your bags together, go home. They wouldn't say, you've got to stay. They say, pick your stuff up, don't forget about logging out. Forget about logging out, we'll do that. Get yourself off home, you need it at home. And that's exactly what it is for me. Just get yourself off. If you need to go home, you need to go home. And I was very, very lucky that way. And this is when Shana said, I'll come to how it worked with me within the organisation. That's exactly what it was like. You need to go home. Your mum needs you, just go home. So them allowing me to work permanent nights, which is quite unusual at that time. Not many people did, very, very few people did that. I was maybe on a handful of people that did permanent nights, and they allowed me to do that to enable me to continue working, and also to enable me to fulfill my other role at home as a carer. And following mum's death, having that job at Yaz, being able to work there, it gave me something to wake up for in the morning. It gave me something to do. It gave me something to focus my mind on. It gave me an opportunity then to help other people as well. And that, to me, being able to help people share my situations with them, learn from them how other people coped, and maybe help people learn from me how I coped. That helped me manage a little bit better. It helped me pick myself up as well. And it was such a huge loss to our household, losing our second mum, that it completely knocked our family for six. It absolutely did. And it took us a long time to recover. And I don't think you ever recover from it. Never, ever. You manage, you cope, but you never recover. So in effect, that's just a snapshot of my journey as a carer. Just bear me a second, please. I need to cough. I won't be a moment. Now, I always say that I was a carer. I never considered myself to be a carer. I considered it as always my duty to do what I did, to look after, to help, to wash, to cook, to clean, to sit down, have a chit chat, have a cup of tea, have a meal together, cook together, share together. Never as a carer, but as a daughter, as a daughter-in-law, as my duty. So I hope that's okay there.
Thank you, Anila. And, you know, I can really resonate with what you've shared today, because, you know, I'm a carer for my mum as well. And, you know, it can sometimes take a toll on you, you know,
Absolutely.
when you don't get that support. And, you know, it's just, you know, culturally, it's just an expectation,
Absolutely.
as Kez said as well, you know, as being the eldest daughter or the eldest son, it's automatically the responsibility lies on you.
It is.
So thank you so much for sharing that.
You're welcome.
And, you know,
Thank you for listening.
You know, looking after your, you know, your parents and your mother-in-law as well. Would anybody like to ask Anila any questions? Kez, you've gone off mute.
Yeah, thank you so much, Anila, for sharing such a powerful and dynamic story, just in terms of the impact on you as an individual. So for me, rather than a question, Anila, my observation from hearing from yourself, and the key theme that's come out for me, and I think it's come out from each one of us as speakers, is around the whole notion of how we regard ourselves as carers automatically. We don't need to be told that we have to do this. You know, just some of the examples you've given are quite powerful. You know, in certain sections of the community, you know, you've shared an example of your own mother, your own father, but then as a daughter-in-law, the responsibility you saw in terms of your mother-in-law as well. So, Huma, I think there's some key message here about how carers identify and define themselves within certain section, and even you know, I think that's something that came out quite loud and clearly. And something else, I think, Anila, as an observation from hearing from you, and obviously I'm aware of you, I know the wonderful work that you do at YAS, you know, the fantastic work you've done there over the years, but more importantly, your role as a counsellor in the community also is very, very powerful.
Absolutely.
And I think, you know, there's something there about how we influence that within the parameters of the local government. And I'm sure you do that in your world. But one final message when I'm hearing you is about flexible working. You've talked about the night shift working, starting late, mid-mornings. That's again, Hummer, about flexible working. And it is so important for our carers to be able to come to work knowing that they are not in a 9-to-5 fixed job, that there's that flexibility is there, and that flexibility can be arranged and can be developed if required. So just wanted to say thank you, really, Anila. I think that's a really powerful story you've got there.
Thank you, guys.
And again, I can imagine just how much that's done for you, for your personal resilience, your experience. And just like you said, Anila, you know, it put you in a position where you like helping others.
Absolutely.
And that really resonated with me. And I talked about it as well. To get over my issues and my challenges and to help with my helping others is something that helped me
Absolutely.
So thank you.
And I think you're very right, because you stop thinking emotionally, you start thinking practically, and that's what I do. I don't, when any situation occurs, I don't think about it emotionally. I don't start going into a panic and start melting. I think about a practical way of dealing with it. Sometimes that can come across to other people as though I'm being really hard, but honestly, I'm not. I'm just, my head is thinking, right, we'll look at the next step. What do we do in this situation now? You can panic afterwards, got plenty of time to panic afterwards, but right there and then, I need to be practical. I need to deal with the situation. And that's one thing it's taught me over the years, is to think on my feet, think practical, and deal with it. Have a meltdown afterwards, which I've had many of in this past couple of years, especially working through COVID. I think we've all experienced huge emotional issues. I know for one, it's impacted me greatly, losing colleagues, losing friends, going home from work in the morning, where Kez knows how much I love my job. I absolutely love doing what I do. And in a way, I think I was made for this job, because God wanted me to help people. That's the way I look at it. And I just hope that those people who I have helped over the last 25 years as an emergency dispatcher, that I've done it in a good way, calmly, professionally, with respect and compassion and empathy, the same way I'd like to be helped and treated if I was on the other side of the phone. So.
Absolutely, Anila, and thank you so much. And really valid points, Kez. We will be making recommendations for Shaheen and the wider West Yorkshire Healthcare Partners Partnerships Unpaid Carers Programme. But I think, I think throughout COVID, what I found is that employers have given their staff more flexibility, and I think that, things are coming back to normal, and people are expected to go back to their normal working patterns. But it's certainly a recommendation that we're going to be making as well, because it doesn't stop here. Employers need to be more flexible when looking at employing people from diverse backgrounds who have got a working who have got a caring responsibility. So yeah, them are the recommendations that we'll be putting forward. Elaine's put, thank you, Anila, for sharing your amazing story. And yeah, does anybody else have any questions? Sorry, Shaheen, you've got your hands up.
Just echoing everything, Elaine, what Kez has said. Thank you so much. That was really powerful, and I nearly cried, I have to say. I can't sit on these webinars. They're not made for me. I realise.
Nothing wrong with having a cry, Shaheen. Nothing wrong at all. Honestly, trust me when I say that. There's nothing wrong at all.
After listening to you and the responsibility that you've taken on from such a young age, and all the way through up to now, and not losing just one mum, losing two mums. Now, Kez will know very well, we worked very, very closely through the pandemic right at the start. And I'm not going to talk too much because I'll have Kez in tears as well, but we dealt with a lot of death. A lot of death. 5 people, 6 people dying a day. And I honestly haven't had the space till this day to really sit with somebody. And when I say sit with somebody, a counselling support, which is going to work for me. And I know that Kez hasn't. We've had personal losses. Sadly, if you don't mind me saying that, your mother died, Kez. My mother died. And beyond that, we're supporting the whole community. And I'm just going to ask you a question, is that, did you ever reach out for any kind of bereavement support?
No, because I didn't know it was available in that time. And we're going back a few years now, where the family, your neighbourhood, people who live next door, your friends, they were your bereavement support. Those were the people that you'd ring up when you were having a bad day, speak to your partner. I mean, I'm very, very lucky. I've got a really good partner. I've got a very understanding partner. So if I'm at home from work and I don't want to talk about anything, I just want to have a quiet day, he understands I've had a bad night at work. I've probably dealt with multiple deaths, births, and everything else in between. Plus, that's obviously brought back whatever I've experienced in my life. As you're aware, my job you never know what you're going to get. I could sit down, put my headset on, I could deliver a baby, or it could be 5 cardiac arrests one after the other. You know, some survive, some don't. As you say, these past couple of years have been really, really hard, and we've had to deal with unprecedented numbers of young deaths, which are not natural, which are not normal. And you never expect that, you know, within a 8-10 hour shift. You'd get 1 or 2, but we've had to deal with sometimes 6, 7, 8, maybe more. So having a very understanding partner who has allowed me my space, but then also with a cup of tea, then sat down and says, right, I'm going to talk about it today, because he's got his own experiences. He's served the community as a police officer for 30 odd years, so he knows how difficult it is for uniformed staff to open up about how they feel, because when we put that uniform on, you know, we're the defenders, we're the carers, we're the look after us, you know. We want to look after people, we want to make sure everybody's okay, but behind that uniform we forget there's somebody who also needs that arm around their shoulder, that, you know, forehead touching, saying everything's going to be okay, you know, you're going to be all right, but we're here. But then we put that facade on, don't we, put that uniform on, and that's us then, you know, ready to tackle the world. But we need to tackle our own loneliness, is one of the words I could use, our sadness. Whenever you deal with a death, it exacerbates your own sadness as well, because you think about the times where you've lost people, and it brings it all back. And I've always said, I mean, now for the past few years, I've come out of work and I'm sat in my car before I've come home in the morning, and incidentally I finished work at 5:30 in the morning. I was sat in the car park and I've had a really good cry before I've set off home, because I think if I bring that home, you know, I'm never going to be able to shake it off. I have a right good bawl in the car, proper tearful cry. I don't care if my makeup's running down my face, I'm not bothered. I come home, and I come home feeling as though I've gotten rid of some of that pressure, that burden. But you're right, there wasn't anybody there for me, for people at that time who were in the same circumstances as me to go to. You could talk to your doctor. They didn't give you antidepressants in those days. They told you to go away and pull yourself together, you know, go sort yourself out, go talk to somebody, you know, talk to an auntie, talk to a cousin, talk to somebody, get on with it. I'm 57 years old now, and I sometimes feel that I've missed out on quite a lot because I was chasing my tail quite a lot of my youth and, you know, growing up, where I'm absolutely honoured and privileged that I've got access into people's homes, you know, as a counsellor, and into people's lives as an emergency dispatcher, at their worst times, at their happy times. And, you know, I'd always want to make sure that when I am talking to people, when I am with people, when people are experiencing hardship and death, and, you know, and anything in between, that I am allowed, you know, to offer them that shoulder, that they know that they can talk to me at any time, that they understand that I have been through it. I haven't been through what you're going through now, probably, but I have been through it myself, so I know what grief's like. And incidentally, because of that, I've recently taken on the patronage of a bereavement service. And I think it's really important because bereavement has been so close to my life. You know, it's been there all the time. And bereavement's just not about death. It's about other kinds of losses as well. It's about losing who you are to become somebody else so that everybody else can manage around you. That's bereavement in itself, you know. Losing contact with people is a bereavement because you relied on those people and you don't have that contact there anymore. Whether it's because they've moved on, whether circumstances don't allow you to have that, you know, many things change. So bereavement isn't just about death, it's about a whole load of things, So.
Thank you, Anita. And, you know, culturally, it's not, you know, it's not a done thing, is it, to look for bereavement support or counselling, you know, after you've lost a loved one, because you're just expected to, you know, kind of like get on with it. And as you said, your friends, your family, they become your support.
Absolutely.
So I think, you know, it's fantastic that, you know, the work that you're doing with champions like yourselves, like Elaine, Kez, Shaheen, and yourselves who are doing great work on the ground. to champion the cause of working carers from ethnic minority communities. I think Caroline put something in the chat box to say, so good to hear your experiences as someone trying to support carers in the workplace, see that carers are working 2 roles and to make sure that you are supported. How else can we support your own self-care as an organisation? So I think this is open to all our panel. Anila, Kez?
I mean, as I said, my organisation, I've been very, very lucky. I think in a way, we set a precedence, and we set a new way of working within YAS, where things from when I started working for the West Yorkshire Metropolitan Ambulance Service in 1997 to now have changed rapidly. There's a lot more flexibility. As I said, I've been working permanent nights now for 21 years, and that, you know, nobody had ever done that before. People were like, well, are you sure you want to do permanent nights? Are you sure you want to be like, you know, just here at night time and not coming during the day? Well, yeah, because it works for me. You know, either it's that or I pack it in completely and stay at home, and I don't want to do that. I love what I do, and I'm good at what I do, and I want to continue to do what I do. And they were brilliant, you know, they said, that's fine, okay. But, and that set a precedence for future, you know. Now people are working permanent nights, because for various reasons they can't do days. For me, it's been beneficial because I can do my council work during the day and I can go to work at night. I go to work at YAS to, in a sense, I always have a laugh. I say I go there to relax because I can sit down and do that job with my eyes closed. I know what I'm doing, you know. I know how to do that job. I put my headset on and I'm ready. You know, as soon as I'm plugged in, I'm ready to go. I completely switch off because I want to be able to give the best care to whoever I'm speaking to, give them my time. While they're on that call with me, I am focused on them, and that's all that matters, no matter who it is. You know, whether they're ringing for whatever reason, even if it's for a chat, because some, you know, people are lonely. And these past 2 years have really proved how difficult it's been for people not having anybody to talk to. It goes back to what we were saying about who do you talk to when you need that support. People dial 999 because they want to talk to somebody. They want to be able to offload on somebody. They'll shout, they scream, they swear, they cuss. But you've got to understand, you know, nobody would do that if they weren't in need to have somewhere to vent that anger, the emotion. So they ring us, and hopefully by the time we finish with them, they've been signposted, guided, or calmed down so they can get on with whatever they need to do for the rest of the night. And that's part of what we do. You know, it's part of our role. We never judge anybody who calls. We've trained not to, because you don't know what they're going through. Again, at the same time, you know, people who ring the ambulance, they'll probably only do it maybe 2-3 times in their entire life, you know, genuinely. And that has to be a good experience. It has to be an experience which prompts them to do it again if they need to do it. If it's a bad experience, nobody will pick the phone up and ever call again. So, you know, you have to have that amount of patience with people, give them that time, because people can't always come out with it straight away. Well, this is what's happening. It takes some time to undo many, many years of being quiet. Like I'm very glad you've given me the opportunity today to come and speak to you about my experiences. I'd never sit down and, you know, talk to my sisters about this, because I know it's painful for them, because they feel that they were a burden on me, you know, that you know, we've got on with our lives, Appa. We went to university, we did this degree, we did that degree, but you never did anything because you wanted to go to uni, but you never managed to do that because of us. And we've had this conversation in the past, so I step away from that conversation because I don't want them to feel as though, you know, they were responsible for me not achieving my life's ambition. But they weren't. It was the circumstances that were responsible. It's what, you know, it's the cards that I were dealt in a way, you know, that were responsible. It wasn't them. So yeah.
And as carers, I think we carry a lot of guilt as well. Like Elaine said, you know, you feel guilty for going to work, and
absolutely,
oh my God, who's going to look after my mom? Who's going to take to the appointment? You know, I can easily say to my, you know, brother or my sisters, can you do that? But then she wants me to take her, or you know, because between me and my brother, you know, we are her main carers. So it is really difficult. And Caroline, I hope Kez has answered your question in the chat box. saying that, you know, there needs to be more focus on amplifying the voice of unpaid carers within organisations, more focus on engagement with staff, and seek lived experiences and how to raise the profile of things such as the carer's passport. So yeah, thank you, Anila. Kez, did you want anything to add on to that?
Just one little thing on that. I think where organisations where there's that appetite and there's a real you know, keenness in terms of raising the profile. From experience, I think it really helps just bringing a group of interested people together, and bringing people together with some commonalities. You find that actually that lived experience and then personal stories begin to come out, but you can also soon see some of them solutions from an organisational perspective. So I just wanted to mention that really, Caroline, I know you're doing lots of great work within Yaz, but maybe, you know, getting a group of about 5-6 people just come together just to have an open conversation and to try and explore what might work from them from Yaz's perspective. Because it's certainly something that, you know, we're trying and testing here at BTHFT about maybe exploring the need of developing a carers network within the organisation. And that might be a group of 5 to 6 people. You know, sometimes having big networks can sort of affect what you're actually achieving from them networks, but a group of 5 to 6 people as a core group, you can often get some really useful information, you know, solutions to some of the challenges that we may be facing, etc. So that might be a good way of it, something to explore, really. Thank you.
Thank you, Kez. It's been very powerful, very honest and open discussions today during our webinar. It's a shame that we weren't joined by all those people that signed up to attend the webinar, but you know, they can go back and listen to these you know, lived experiences through the West Yorkshire Healthcare Partnership and the REN YouTube channel. So we will email it out to everybody for them to catch up on it. So yeah, if anybody doesn't have any questions, Shaheen, do you want to do your closing remarks, and we can get, I think, 10-15 minutes of our working day back?
Sorry, can I just say that in the chat box, we've put in a survey. I'd be grateful if everybody could complete that, please.
Yeah, and also, sorry, I forgot to also mention that Race Equality Network and the West Yorkshire Healthcare Partnership are, you know, working together since April to launch the Message in a Bottle campaign, which is around contingency planning for carers. So, for example, if somebody, you know, somebody you're caring for needs emergency care, you know, the paramedics turn up to the house, how would they know where the emergency information is? So we have translated the Message in a Bottle message in 7 different languages. It's a video message, so you can, Fatima will share the link in the chat box, so please feel free to view them messages and share it with your wider contacts. It will be on the West Yorkshire Healthcare Partnership's website and also on the REN YouTube channel, and I think that was really useful for our ethnic minority communities as well, because often they don't understand what Message in a Bottle was. I mean, I didn't know what it was until we spoke to Shaheen about it, but it can help save lives.
Absolutely.
So
and I would like to encourage people, and please get the message out there. It's so important that when my colleagues attend an emergency, that, you know, there's times where the patient can't tell them, or the family can't tell them anything. So the message in the bottle with the patient's health issues, with medication that they take, you know, this is important information that very, very quickly could help our paramedics, our staff establish what is wrong with the patient, because, you know, many illnesses can blend together and come across as something totally different. For instance, people having a diabetic hypo come across as they're drunk, and sometimes, you know, it's such a false impression. But, you know, these things, the message in the bottle is so important. So encourage as many people as you can to take it up, you know, and stick that sticker behind your front door. put that bottle in the fridge or the cupboard and stick that sticker where your documents are going to be, so that we can have access to them very, very quickly to be able to help people as quickly as we can.
Yeah, thank you, Anila. So yeah, Shaheen, I'll pass over to you.
Thank you. I'm still a little bit choked up, to be fair, listening to everyone. If anyone wants any further information about any of the things that we've talked about, manager's guidance, message in a bottle, all that information is on our website, but you can send me an email and I can send you all the comms we've done or anything else. And again, I think we've got Race Quality Network's email. I think you've got a link to the YouTube videos, real worth watch. It's a few minutes, I think they're about 2 minutes long if I'm right, lots of different languages, wealth of information within them. Just really by ending saying thank you very much for sharing such personal information from yourselves. And you can see that I'm still a bit choked up. It's been really emotional, but moving forward, I think there's lots of key things and themes which have come out across all 3 webinars. There's lots of work to be done across the board with working carers, and I've got some people who we work with. Lyndon's been extremely quiet, but we are doing some fantastic. He's from Kirklees. Everyone does an amazing job. There is lots of work to be done around raising the profile of working carers, unpaid carers, people who are trying to juggle the 2 things, and even more so work to do around the identification of working carers. But you can only put in things in place, groups, help and support, if people identify themselves. And I understand that why we don't identify, because it's embedded in us from a very young age. That's just what we do. That's our responsibility. Whether we look at it from a cultural perspective or a religious perspective, from a faith perspective, for me to look after my parents, it's mentioned within our holy book, the Quran. So we're not going to see it as a burden. But we talked about care homes in our other webinar on Wednesday. So I wonder if Hummer's going to share some snapshots of what that was like moving forward. But there is a lot of work to be done. If anyone wants to still connect afterwards and send an email and the thought, oh, I've had a bit of a bling moment, please do feel free to get in touch. And I hope that we can continue having these conversations and raising the profile so that we can really meet the needs of our diverse communities. Thank you very much.
Thank you, Shaheen. Yes, we will be sharing everything by email with all the attendees and those who couldn't make it. And I would like to personally thank all our speakers, Shaheen, Anila, Kez and Elaine, and everybody else for attending. I know that you've taken valuable time out of your working day, but I hope it's been useful, and I hope we can all take something back from this today and look at how we can work together to meet the needs of the unpaid working carers from ethnic minority communities and all diverse backgrounds actually across the West Yorkshire Healthcare Partnership. So thank you so much, and look out for our Twitter feeds. So please retweet anything that we tweeted today, and thank you so much. Thank you. Shaheen and Adiba and Fatima, can you just stay on? No? Go on, Shaheen, you were going to say something.
I was just going to say, I've got to do something in an emergency.
Okay, that's fine. All right, okay.